Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Welcome. My name is Annie Rogers, and on behalf of the Attitude team, I'd like to thank you for joining today's ADHD Experts presentation titled The Unexpected Link Between Migraine Headaches and ADHD. Living with ADHD, as it turns out, may result in literal headaches. According to research, ADHD symptoms and challenges, from impulsivity to disorganization, may contribute to or worsen migraine headaches. In turn, headaches may exacerbate ADHD symptoms. It's a cycle and a relationship that few physicians recognize or understand. In today's webinar, we will learn more about the connection between ADHD and headaches, and we will leave with strategies to overcome these problems that lead to migraines. Leading today's presentation is Dr. Sarah Cheyette. Dr. Cheyette is a pediatric neurologist. She graduated from Princeton University and UCLA Medical School. She is a co-author of the books Winning with ADHD, a playbook for teens and young adults with attention deficit hyperactivity disorder, and ADHD and the Focused Mind, a guide to giving your ADHD child focus, discipline, and self-confidence. Before I hand over the microphone to Dr. Cheyette, I have just a few housekeeping items. Those of you tuned into our live webinar may submit questions for our expert at any time by navigating to the text box under the video player. To download the slides, click on the Event Resources section of your webinar screen. And if you're interested in the Certificate of Attendance option, look for instructions in the email you'll receive about an hour after the live broadcast. If you are listening in replay or podcast mode, visit attitudemag.com and search podcast number 402 to access the slides, the webinar replay, and the Certificate of Attendance option. If you support the work we're doing here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine. If you do so now, you will receive our spring issue with features on inattentive ADHD, ADHD and menopause, perfectionism, and much, much more. Finally, the sponsor of this webinar is Inflow. Inflow is the #1 app to help you manage your ADHD. Developed by leading clinicians, Inflow is a science-based self-help program based on the principles of cognitive behavioral therapy. Click the link on your screen to download Inflow now at the App Store and Google Play Store. Attitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. So without any further ado, I'm so pleased to welcome Dr. Cheyette. Thank you so much for joining us today and for leading this really important discussion on migraine headaches and ADHD.
Well, thank you, Annie. And I also would like to add my thanks to our sponsor, Inflow, because I am so grateful to have a chance to bring this important combination of topics to people's attention. I'm going to introduce myself. My name is Sarah Cheyette, and I'm a pediatric neurologist at Palo Alto Medical Foundation, which is part of Sutter Health in the Bay Area. And, interestingly, many people are not used to hearing about ADHD from a pediatric neurologist. Traditionally, we treat headaches. And so that's why I'm really excited to talk about this combination, because I don't think you're going to hear this information anywhere else. So the combination of headaches and ADHD is a huge problem, and it hasn't really been talked about. You really can't find information on this, although these are two of the most common issues that doctors see put together in the same people. And a little bit later in the talk, I'm going to explain why, you're not going to hear about this in other places or from other people. There are reasons for that. But this combination is a really personal topic for me because it's how I got into treating ADHD in the first place and recognizing how important a factor it is in people's lives is by dealing with headaches and realizing that, yes, ADHD can be connected to headaches. So whether you have a family member or whether you have a client or a patient or whoever's listening out there, I'm going to tell you why this important information is really specific to just a very few places that you would get this information. And the great news is that once you recognize that these two problems are connected, you can fix both of them at once. And that's so fabulous. You can get rid of the headaches. You can improve life and school and work functioning for people. And as part of that, you might improve somebody's sleep. You might improve somebody's anxiety or mood issues like depression. And most of all, you will help a family function better. So let's talk about how these two things are connected. The first question is, how does ADHD contribute to headaches? Well, we all know ADHD creates stress. So, for example, people are feeling behind all the time. They're feeling not good enough. ADHD also has a lot of time management problems like procrastination, and that leads to a lack of sleep for many people. Lack of sleep contributes to headaches. ADHD has a lot of impulse control issues, right? So these, especially the hyperactive type of ADHD people, have more concussions or head injuries. Those lead to headaches. A lack of planning in ADHD often leads to irregular habits. So if I have to tell somebody, how do you get a headache? Or, here's how to get a headache, I would say, don't eat well, don't hydrate well, have poor sleep. So these irregular habits are common triggers for headaches. And finally, for many people, headaches can be a side effect from their ADHD medicine directly or indirectly, in that the medication could keep them up and cause lack of sleep or keep them from eating and cause headaches in that way. Then, as Annie had mentioned, headaches can also contribute to ADHD. So the headaches create stress and distractions for people, leading to even more stress and distractibility for people with ADHD who already have plenty of stress and distractibility. Headaches also contribute to time management problems. They become the priority. All you can focus on is the headache, and the work or school gets pushed off and missed, and so people get even further behind. Also, the medications for headaches, they tend to make people sleepy, or, to use a very technical term, loopy. And that also makes it hard to function with ADHD. Post-concussion headaches often have worse concentration. I can't tell you how many people's concussions that I've made get better because of a recognition that they may have some underlying ADHD that was mild, but the concussion worsened it. So treating ADHD in that setting may lead to improved headache because people feel better. Post-concussion headaches also cause people to miss a lot of school and work, especially with the recent guidelines that you're not supposed to do anything, which may change, but that's another topic. Headaches can interfere with sleep. If you're waking up with headaches, or if you have headaches that are keeping you from falling asleep, that's another way you can have worse ADHD symptoms. And of course, people in chronic pain, like with chronic headaches, can cause depression and anxiety. That makes them have a harder time with motivation and makes their ADHD worse. Basically, headaches are another obstacle for ADHD people who don't need additional obstacles. And both ADHD and headaches can be associated with sleep disorders. They can both cause sleep issues and create sleep issues. So the anxiety and the depression that many people with headaches and ADHD have make it harder for a lot of people to fall asleep. Or if they do fall asleep, sometimes it makes it harder for them to get out of bed. And the medications for ADHD or the self-medications can also affect people's sleep. And as I just mentioned, both headaches and ADHD are associated with much increased rates of anxiety and depression, which can worsen sleep, create stress. And again, the medications for anxiety and depression can cause headaches. And the self-medication also can cause headaches. So let's take this example patient, Sally. And Sally is somebody who, as I mentioned earlier in the talk, this is kind of how I got into treating ADHD as a pediatric neurologist. I had somebody with a horrible headache for months that we could not figure out how to fix. And then the light bulb went off, and it was the untreated, unrecognized ADHD that was driving the headache. And when we fixed the ADHD in Sally, her headache got much better. And let me go through this with you because I'm sure you all know some Sallys. This is a 15-year-old girl with a history of headaches here and there for a few years. Sometimes her period would trigger them off, but they were just kind of headaches. But around late October of her sophomore year of high school, they started to get worse and become all day, every day. She started taking medications, Tylenol, ibuprofen, Excedrin, every day. And this is something that's real common for people with headaches. They just start hitting the large Costco-sized ibuprofen. But they weren't working. She was also kind of nauseated, and she didn't know why. She started to miss more and more of her school. She started to miss more and more of her activities, and she was getting farther behind in school. So her family did what families do. They took her to her pediatrician sent her to an eye doctor and a neurologist. They found out that there were some headaches in the family. And of course, there was an Uncle Joe who had died of a brain tumor. Sally had maybe occasional marijuana use, by which she meant every night, but not multiple times during the day. And she said it was to help her sleep. When she slept soundly, but she always felt tired anyways. Of course, she slept with her phone in her hand practically and was getting about 6 hours of sleep per night. Despite that, her grades were okay. They were going down. She had A's and B's in middle school, B's and C's in high school so far. She was describing a lot of pressure. She felt stressed out a lot. She worried about school. She worried about her friends. She felt she had to help them. She didn't have really depression, but she did worry about things. She also got way worse, according to her mom, around her period. Worse headaches, worse mood, worse anxiety. She had a history of a concussion about 1 or 2 years ago, being a soccer player. So all the medicines she was taking for her headaches definitely were giving her stomach aches. They made her feel kind of out of it as well. But when we started talking to Sally a little bit more, she always felt behind at school. It wasn't just this year. She had always stayed up late to do her homework due to her procrastination issues. Some of that was the phone. She wanted to finish the homework, but she would sacrifice her sleep. In the 7th grade, she missed a couple of weeks of headaches because of nausea. And, missed a couple of weeks of school because of nausea. And in retrospect, maybe that was due to anxiety, but they didn't know. Teachers always had nice things to say about our Sally, although she was chatty. She never liked to read books. Part of that was that she had to read them over and over and over again. Part of that was that screen time was a huge draw for her. She would make a lot of silly mistakes. She tended to misplace things a lot. She was always looking for her stuff. Her parents had to repeat instructions a lot, and they said, I thought it was just the way she was. She's always been like that. She felt that she was smart, but she always had to work harder than other people. However, she kind of enjoyed the social benefits of being an airhead. It was part of her persona. She was a giggly kid. And, she was known for all her oopsies and mistakes, and she was really good at that chuckle to make light of them. Homework was keeping her up until 2 a.m., but on further questioning, she didn't start it till about midnight, and she kept getting distracted throughout the afternoon and even into the evening. She had to redo a bunch of assignments. Many were turned in late. She would stay home from school a lot, and her parents also were missing a lot of work because of this. She began to feel very isolated because of her headache. Her grades went way down. She and her parents, despite multiple medical tests, blood tests, MRI tests, CAT scan, whatever, ER visits, doctor's visits, she was convinced that the doctors were missing something. And it was probably going to be something fatal or really dangerous. So she was going to a lot of different doctors. Her parents had to take her to a lot of different doctors, and there were a lot of financial stressors from all the medical, all the medicines they were trying, all the tests they were doing, and all the doctor's visits. And, that began to create issues in the family. She had always been a somewhat chaotic kid. And so her siblings were getting sick of her. Her parents were getting frustrated and upset. That nice combination of frustration and worry that you can have as a parent. Well, that was going on. The issue is sort of, what is Sally's problem? I don't know if that's the right way to say it, but what's the issue? Is it the headaches? Certainly the headaches was the obvious thing that fall, but were they a cause of her issues? Were they a cause of her worsening school performance? Or was it an effect of the ADHD that had not been diagnosed yet, but that we started to suspect from the history? Maybe though it was just stress, whatever that is, anxiety, depression. And she certainly had hormonal triggers for some of that. Was it her sleep deprivation? She was getting 6 hours a night at best. That certainly seems to make headaches worse, and it certainly doesn't help you concentrate. Was it effects of her marijuana? Was it effects of her medication? Was it simply that she was a sophomore and now had to read and interpret complicated things, although she was never a reader? She never did any reading. Maybe she was living up to her persona as the airhead, not a good student. And so, all of these factors could contribute to how her performance in school was declining and how her participation in school was declining. And so trying to figure out the effects of all these was our challenge. So what do what should we do? Do we fix the headaches? Well, we could try. There are medications that might help the headaches get better. Two of them, that are common would be Topamax or nortriptyline. These are medicines that you take every day to make the headaches get better and better over time. And she was having daily headaches, so those were certainly an option. But they can worsen your concentration, and she was already not concentrating well. Or maybe we fix the ADHD and see if the headaches got better from the improved sleep, improved mood, from the improved functioning, the lack of stress. Let's see. So the Sally that I'm talking about had a very, very happy ending. We wound up starting to treat the ADHD, and her headaches got back to her here and there type of thing that she had before this sophomore year when she went into the headache crisis. Her life got back to normal. Actually, it was better than normal. Her sleep was better. Her mood was better. She was taking fewer medications, and she also had much less family stress. So we fixed the ADHD by giving her medications and educational support, but really that turned out to be a treatment for her chronic headaches. So Sally was a 15-year-old child, and 15-year-old children or teenagers have their set of issues, but this very well could have happened to Sally's mother or any other adult, her father, because chronic headaches and ADHD are also part of adult life. And so if this had happened to Sally's mother or another adult, that person would have had difficulty performing her job. I mean, forget school, but just, she might have been fired. She also would have had sleep issues. She would have been frustrating to her husband and her kids too. I mean, headaches are very frustrating for people because there's no outward sign of them. There's no pain thermometer, although I would love one. Headaches are really frustrating for the people around you because they don't know if you're really in that much pain or if you're stretching it. So there could have been, if this is happening to adults, that would be a husband or wife being very impatient. There are financial stresses that can come along with chronic headaches or ADHD issues, creating problems in the job setting. And, especially when you are both working and trying to care for a family, if you feel like you can't even get out of bed, everyone's going to notice that. And many people who depend on you are not going to be functioning. And then there are secondary problems from that. Mothers and fathers both would self-identify as a failure. They would feel like, I'm not good enough. Why bother? I don't think I can get another job. And the downstream effects of that as an adult are really, really serious. So, oh my, even worse than lions and tigers and bears, we've got problems from this combination of headaches and ADHD. And they are not rare problems. There are many Sallys. So don't focus exactly on the numbers, but these are the numbers of adults in America and kids in America. And I'm going to use these numbers in order to in the next few slides so that you can see how big a problem this is. Headaches are a huge problem. Most people with headaches have them just at least, once or twice a year, but a third of those people with headaches have severe headaches and headaches for more than 15 days of the month, which is a huge number of headache days of the month. That is not infrequent. The numbers are 1 to 4% of all the adults, but my goodness, that's probably an underrepresentation. So if you use the numbers before, there are somewhere around 150 million people with headaches once a year or more, 46 million with severe headaches once a year or more. But there are 2 to 10 million people at least with headaches 15 or more days of the month. That's half the time, folks. The numbers in kids are harder to obtain because there are way fewer studies of headaches in children, but somewhere around 60% of children or adolescents have headaches. In younger kids, it's maybe 20% with significant headaches, but in adolescents, maybe about half the kids will have significant headaches here or there. Hormones, lack of sleep, poor habits, stress, who knows? So if you want to look at the numbers of actual kids, there's 50 million kids in America ages 6 to 17, and maybe 5 million of the younger ones have headaches, and maybe 25 million, and again, this may be an undercount of American teens have headaches. ADHD is similarly prevalent. So again, not focusing too much on the actual numbers, but there's 10 to 20 million adults with ADHD if you take the numbers, although it feels like those numbers are climbing every day. 2.5 million kids under 11 with ADHD and over 3 million kids in their teens with ADHD as well. Of the 46 million adults in the U.S. with severe headaches, we don't know how many of them overlap with ADHD and vice versa. Of the 10 to 20 million adults in the U.S. with ADHD, how many of them are the severe headache patients? We don't know. Same with kids. Of the 5 million children with headaches, how many of them also have ADHD? Of the 25 million teens with headaches, how many of them have ADHD as well? So, which ones are your family members or your clients or your patients? And the overlapping conditions make this a very, very difficult question to answer as well. Many adults with ADHD have huge rates of depression and anxiety. Somewhere around 20% have severe depression. Another 13% have more minor depression. So that's a third of adults with ADHD have significant mood issues, half have anxiety. And the numbers may be a little bit less in kids, but there's still quite a significant increase over kids without ADHD. And anxiety and depression are a huge trigger or comorbidity of headaches as well. So many adults with headaches also have anxiety or depression. And in kids, the numbers are also probably huge. Again, nobody really does this research despite the numbers of kids that we're talking about. In kids with severe headaches, probably half have some sort of anxiety or depression or both. And in kids with chronic daily headache, yes, there are kids who have headaches every day. There's huge amounts of anxiety and mood disorders as well, but nobody really knows these numbers. And again, with the sleep disorders in adults, there is a most definite association between ADHD and sleep disorders, and a definite association between headaches and sleep disorders. In pediatrics, there are fewer statistics again, but again, there's an overlap between all of these things. It's funny, as a doctor, you go to study ADHD and you learn the ADHD chapter real well. And then maybe you go to study depression and you learn that, or sleep disorders and you learn about that. But the problem is that there are very few things that we as doctors can educate ourselves that talk about the combination of everything all at once. And that's really the important part. Different doctors for different things, therefore, are a huge, huge issue. So this, folks, is one major reason why the combination of these common things really hasn't been talked about. If you have a headache, you get referred to a neurologist. Many, if not most don't treat ADHD. And then if you have ADHD, oftentimes you get referred to a psychiatrist or a psychologist, and they definitely don't treat the headaches. So nobody is there who can really do both. And if you go to an ADHD specialist perspective, this is how your world looks. You're thinking about the ADHD, and all the other stuff is less important, right? The anxiety, the depression, the headaches, the sleep disorders. But in reality, here's how everything kind of intersects. Headaches and anxiety and sleep disorders are more common than depression and ADHD. So you can look at it. These are the same numbers, but in a bar graph to give you an idea as to how these problems are defined as separate problems. So again, the sleep disorders and the anxiety and the headaches are more common than the depression and ADHD. But if you focus on ADHD, you're kind of missing these important things. The numbers in kids, if you look at these numbers here, sorry, I said in kids, but the numbers of adults, if you add up all the numbers, this is the same graph. There's 185 million people running around with these disorders out of 247 million adults. Clearly, there's more overlap than chance alone. And similarly with the kids. So if you look at kids, you've got anxiety, sleep disorders, headaches being more common than depression and ADHD. And if you add up the numbers, that, there's a total of 92.2 million kids who have been diagnosed with these things, but there's only 49 million kids in America. The take-home point is that, there is certainly significant comorbidity in adults. In pediatrics, there's even more significant comorbidity, probably, but the statistics are kind of screwed up, and it's hard to know. We do know that there is a huge, huge financial impact of headaches. Headaches are a $13 billion cost to society in the U.S. Some of that is the cost of medical care and productivity loss as well. There are a lot of workups for headaches, including a lot of unnecessary MRIs and other tests. If you can find a practitioner who can understand ADHD as well, that person could consider the contribution of ADHD for free. And you as the patients, you as the care providers, you may need to bring up the ADHD to your care provider, because that care provider, as I'm saying, that may be a neurologist who doesn't think about ADHD, or an ADHD provider who is not prepared to think about the headache part of your life. Here's something I found out as a provider too, and this is really important. A lot of the medications for headaches, they don't work so well if there's constant triggering from the ADHD part of your life. So you could try lots of different medicines, and some may work very temporarily. But if the ADHD issues are continuing, then the headaches, if they're related, will also continue. So one way to treat the headaches is by treating the ADHD. And you get the added bonus of treating the ADHD, which is really, life-changing for people. So many people, either providers, or when I'm sitting in an exam room with a family, okay, we've identified the problem, but how do you know what to treat first? Do you treat the headaches? Do you treat the ADHD part? Well, this is an individual type of decision. There is no answer that is absolutely the same for everybody else. Trying to figure out what came first seems to be as good a guideline as anything. If there's a long history of ADHD and then the person develops the headaches, and if the ADHD is undertreated in the first place or unrecognized, you might consider treating the ADHD first and seeing what happens. This is often something that is, you might have to say, well, this is not the conventional treatment for headaches, but my goodness, it could work. If there's a long history of headaches, and then they develop more ADHD types of symptoms, you might need to consider the role of the headaches in the person's daily functioning as a first place. Also, you want to see what's been tried before. So if the person has been taking a lot of headache medicines and that hasn't worked, you might as well try a different approach. Especially treating ADHD can be super fast if you go with the stimulant medicines. It may be a very fast way to figure out if the headaches will get better from it, even faster than some of the headache medicines. If the ADHD approaches haven't worked, okay, let's look at the headaches and see what we can figure about making you feel better, because if you don't feel well, you're not going to function well. There are cognitive behavioral approaches that might help both of these issues. So, for example, paying attention to sleep, both the quantity of sleep and the quality of sleep, is super important with both of these. So many people right now have their sleep disrupted for many reasons. I definitely use the internet myself. So I love the internet. I think it's wonderful. However, there's a time and place for everything. And the internet, when it keeps me up, it's not wonderful. Many people are having sleep issues because of too much electronics before bedtime. So, I always tell my patients that you want to be the boss of your screens. You want to boss them around. You don't want them bossing you around saying, play me, or watch me. And then you have to do that. At nighttime, it's a great time to do some reading. You want the lights low, and you want to have your phone off. This is especially a huge issue in teens, where sleeping with your phone on and having it go zzz, 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 is huge disruptor in teens, particularly. Paying attention to your food intake is important. So your brain is the most metabolically active part of your body. So pound for pound, your brain uses more glucose than anything else. There are more pounds of muscles in your body, but your little old 2.5 pound brain takes a lot of glucose. So, making sure that you have enough fuel in your body to think straight is an important cognitive behavioral approach for ADHD. But getting hungry is also a huge, huge part of triggering headaches. So for headache people, we often say, you better eat enough or frequently enough so that you don't get hungry. So the same approach could help both. Migraines are often triggered by changes in schedule. Okay, so when people get off their schedule, and that could be too much sleep all of a sudden, not just not enough sleep, it could go both ways, or even lack of stress as compared to their regular amount of stress. That could trigger off a migraine. Some people have their migraines triggered off when their schedule changes, even if it feels like a schedule change for the better, such as going on vacation. What a migraine really is, at its heart, it is that your brain gets triggered off by something. There's a nest of cells deep in your brain, and that nest of cells then sends out pain signals that go through nerves that go to your head. It's the nerves that transmit the pain signals. Your brain does not have any pain signals or pain receptors in the brain. That's why some people can go through surgery on the brain and be awake the whole time once they get through the skull and all the skin stuff. But the point is that migraines, the most common kind of headache, are triggered by lack of sleep, lack of food, lack of drink, or changes in schedules. And those things can affect ADHD in many important ways too. Finally, and this may be a really life-changing type of thing for many people, but the cognitive behavioral approach that stresses grit, like, okay, you don't feel great, you still want to go and do your thing. That's really helpful for headache management. When people have chronic headaches, the pain specialists and the headache specialists advise them to get out of bed and do their activities. That seems to make the pain less. Distraction, if that's what it's from, or just the good feelings you get from having a activity to go to, help headache pain. In kids, this is one of the most important ways we treat headaches. It's also important with ADHD too, to remember that if you feel like something is hard, it's important to learn how to manage it and learn how to deal with it and learn how to continue doing. So again, that's also a cognitive behavioral approach that could help both headaches and ADHD. So in summary, why is this not going forward? Hang on. Whether you're dealing with ADHD, which I love this cartoon, or ADHD cartoon number 2, or ADHD cartoon number 3, and this is the last one. Whether you're dealing with ADHD or whether you're dealing with headaches, and any other complicating factor like mood issues or sleep issues. And don't forget medication side effects, whether they're prescribed or not prescribed. In conclusion, the issues may affect the same person. So it's important to consider everything. Here's how to reach me. And I'm going to hand this back to our hosts. And I want to thank you to Attitude Magazine and Inflow for making this possible.
Thank you so much, Dr. Cheyette. That was very thorough and helpful. We do have a lot of questions, so I will dive right in.
Okay.
Quite a few about special considerations for migraine in particular. So one person wrote in, I have headaches and they used to happen several times a week. Since being on Vyvanse, they have stopped or reduced. However, yay.
Sorry, little celebration.
But here's the catch.
There's a however.
Mm-hmm. When I get a migraine from, and she cited weather or barometric pressure, they can last 3 days, no way to get rid of them, even on the stimulants. And we've heard some similar comments that migraine seems to be almost, in a class of its own. Have you found this to be true? And can you offer some guidance for those folks who, even while taking ADHD medication, continue to battle the migraine?
Sure. And of course, I should say that any advice that I give is sort of general advice, and you should talk to your individual practitioners. But there's two parts of treating migraines. One is the preventative kind. So, how do you keep from having so many? We talked about that little nest of cells deep in your brain. How do you keep it from getting triggered off and creating a migraine? And the Vyvanse may have helped this person with that. So she's getting way fewer headaches. Terrific. But we still have to deal with part two, which is once a headache gets triggered off, once that nest of cells then sets off the nerves that cause the pain, how do we turn that off? So the solution for that is a different kind of solution from how do you keep from having so many. In that case, what I would say is that hopefully this person has tried a variety of what we call rescue therapies for headaches. So these are things stronger than Tylenol and ibuprofen. There are two different kinds. Basically, there are the triptan medicines, which are Imitrex and Maxalt, and there's a bunch of those. Those have been the standby for about the last 10 or 15 years. But in the last 2 years, there's been a new class of headache medicine that deals with sort of like an antibody response. This is, they're called CGRP inhibitors, and they're fantastic too. So usually people try the triptans first and then this next prescription medicine. Hopefully, most people will have benefits from that. So I don't know if this person who wrote the question has tried anything other than over-the-counter medicines, but there are a lot of prescription medicines that can turn off a headache once it starts.
Okay, very helpful. Thank you for those details on addressing migraine both before and sort of during. Another question, sort of related, is there any research that you know of specifically regarding what type of stimulant, amphetamine or methylphenidate, works best to address headaches in individuals with ADHD? It's just a personal trial and error situation?
Yeah, I wish I had a thing that I could do the old Star Trek tricorder thing, or I wish I had something that helps me figure out what medicine works best for the person before I give it to them. It'd be really great if I had a scan or something that tells me that you, sir, are a Ritalin person, and you, ma'am, Adderall's the thing for you. But there isn't any tests like that. There are some people walking around with genetic tests, but I do not believe that answers the question that I need answered, which is what's going to work best for you and create the fewest side effects. If you have other family members who have done great with one thing or the other, that's as good a guide as any. That might be the thing to try first. But unfortunately, both for ADHD and for headaches, there's no clear answer. I will say that some of the newer ADHD medicines are released in different ways. So some of the newer medicines are the same active ingredients, but released in a more steady fashion. Examples of that might be Dianavel or Quillavant or Quilichu. I mean, there's several of them out there where these are newer versions of Adderall XR or newer versions of Concerta. So the steadiness with which they are released may improve a side effect profile for a particular person. So if you have headaches with your Concerta, switching to a Quillavant or Quilichu might give you the same benefits that you're getting from the Concerta, but with fewer side effects. So that is something to consider and talk to your individual providers about.
Okay, that's a very helpful stipulation there, because I have heard from the listeners here today, several people have reported that their neurologist or another medical practitioner has actually dissuaded them from using Adderall in particular because of increased risk of headache. But it sounds like we do not have the research to back up that Adderall specifically would trigger a headache. As you said, it's very individual and requires careful, work with your care provider to.
That is correct. And the good thing about it is you'll know right away. So if it triggers a headache, you can all email me or whatever and say, boy, you were wrong. No, I'm kidding. I don't want to get those emails. But the issue is that, the statistics on all of this are very poor. And while headache could be a side effect of any of the ADHD medicines, you'd have to figure out which one works best for your ADHD and which one triggers your headaches or not.
Okay. Now, we do have quite a few mothers or parents of Sallys out there, and
Yes.
quite a few Sallys out there. And a question I'm seeing a lot, I should say grown-up Sallys, is what is the impact of hormonal changes, puberty and menopause, on both headaches and ADHD? There definitely seems to be a theme here.
Yes. And here's the deal, which is that females tend to start having headaches around 12 or so. That's the most likely time to start developing migraine headaches for a woman, for a girl. Boys tend to develop them earlier and then outgrow them. Girls tend to develop them at puberty, and then they stick with them. And that may be hormonally related. That's been the tried and true explanation. However, I will also note that it's in middle school, right? And in middle school may be a time where the ADHD might become more evident for a girl, which is, like they tend to be a little more inattentive rather than hyperactive. And so they could kind of float by on intelligence in school through grade school. And then in middle school, the stress of school may be also catching up with them. They're also all getting their phones at that time. And so, the sleep issues from the phones could be an issue. So there could be multiple factors involved. But, sometimes with hormones, it takes a little while for them to kind of stabilize. And the change in the hormonal status could be a trigger for their ADHD, for their headaches. But the ADHD issues could also be starting to creep up at that time. In terms of menopause, mostly I would say, now it's not, huge, but many people's headaches can improve during menopause. Sometimes they get worse. And sometimes it's in that crazy period as they're transitioning from regular hormonal cycles to, sort of the spurts of hormonal cycles in the premenopausal time, that could be a problem too. Of course, that's also a time of your life where you're trying to juggle a lot of different things as well. So there's stress issues there. But hormones are definitely connected to many female headaches.
Okay. Yes. Really interesting comments from both parents, women and men, actually, and loved ones on this topic. And let's see, I got a good question here regarding, so those who are caregivers and helping their adolescents to address headaches with ADHD. A parent wrote in to say, what are some of the key questions and concerns that you would share with your adolescent's doctor and or psychiatrist if they're experiencing headaches in addition to their ADHD symptoms? What are some of the key pieces of information to pass along?
Yeah, I would be honest in terms of, the questions that you probably have in your mind as to what's creating the most problems. And, sometimes the teen is the best person to answer that, but sometimes they're the least objective person also. So it's often a combination between, the person experiencing the problems and the people around them who may be somewhat more objective. I think it also comes down to how many headache days that they're experiencing and how big of a part of their life are the headaches. I certainly would be really clear to the ADHD provider to say, I just want you to know that migraines run in our family and that, Sally or Johnny or whoever we're talking about could be having a lot of more problems from pain than you realize. And here are the medicines that they're taking for pain, and here's how the medications affect them. Here are the side effects that they deal with. So, making sure that the connection is obvious to your provider is part of this. And hopefully the provider can then take it from there. If you're talking to a neurologist about the headaches, be sure to let them know that the ADHD has been a concern. Remind them of the medications that they're taking, and make sure that they know about the stress. The neurologist may or may not know about how to treat ADHD and may not be an expert on that, but hopefully they will be able to, draw a line that and realize that treating the ADHD or making sure that it's treated effectively could be an enormously helpful tool for the headaches. And again, specifically talking to each doctor about sleeping, anxiety and depression, and any other substances may help that provider give you the best care.
And that leads actually very nicely to our final question for the day. A lot of people asking, is there a good way to find a practitioner who understands both ADHD and headaches?
This is a difficult question. To me, it's the most natural thing in the world, but it's hard to find people who do both. I'm hoping that as ADHD has become destigmatized and more common, that more providers will treat it. The fact that many of the treatments are controlled substances should not be, but it is a hurdle for many doctors. And we don't have sort of scientific and objective ways of treating either thing, either the headaches or the ADHD. It's not like you can do the lab tests and see the liver enzymes come right up or whatever. So I do think that a lot of providers in general are frustrated by these two important disorders. But I'm hoping that that will change over time. I would say that talking to your pediatrician or your internal medicine doctor is a good person to start with because they bridge both of those fields and they know the personalities of the specialist doctors in their community that they refer to, and trying to find the right person who has openings at the right times, and of course, who takes your insurance is not for the faint of heart. It's a really difficult thing. But I think asking the providers in your area who they recommend would be the way that I would start.
Yes, I will make a small plug here also that we do have a directory of ADHD specialists on attitudemag.com. I cannot promise that we have folks who have a specialty in both ADHD and headache, but that is certainly another place to go and look in your area, or for those who help patients remotely as well. And I also wanted to mention, just because of the sheer volume of questions that we had about menopause specifically, that we do have a great feature article in the summer issue of Attitude that is all about ADHD and menopause, with lots of information about ways to effectively manage symptoms during both perimenopause and menopause. So please be sure to check out the summer issue, which is our latest. And also, we hope you will join us for more Attitude webinars. If you are listening in replay or podcast mode, visit attitudemag.com and search podcast number 402 to access the slides, the webinar replay, and the certificate of attendance option. If you support the work we're doing here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine. If you do so now, you will receive our spring issue with features on inattentive ADHD, ADHD and menopause, perfectionism, and much, much more. For now, Dr. Cheyette, thank you so much for this really illuminating conversation. And thank you to everyone who joined us today and submitted your feedback.
Thank you all.
For more Attitude podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.